Now, a Mantoux test is being performed in a nurse who is working in a TB clinic. If you do that, what do you find the Mantoux test? Come on, Nagappa, Roja, Ranjit, give your possible answer. Yes. What will happen if you do the Mantoux to a nurse who is already working in a TB clinic? Roja says a positive skin test. Ranjit says probably she's suffering from TB. Okay. What is Nagappa's answer? Let me see. What is Nagappa's answer? So you should remember that Roja is absolutely right. A positive skin test. Once more, you should remember, how do we do this Mantoux test? Typically, a person who is exposed to the mycobacterium, TB is caused by Mycobacterium tuberculosis. So the one who is exposed to that, his immune system, the T cell, it got sensitized. So to that sensitized T cell, if you happen to give an intradermal soluble tuberculin molecule in the form of the Mantoux, then that will make the sensitized cell to get activated. This activated cell will produce interleukin 2, interferon gamma, interleukin 1, TNF alpha. All these inflammatory mediators are being produced. And that will attract a lot of macrophages to come. And this macrophage recruitment and activation will typically lead to that edematous indurated. Induration ka matlab hai? What is the meaning of induration? Hardening. Hardening is called induration. Hardening. Anything which is hard is called smooth. Hard is called induration. So that induration, erythema means redness. The redness, erythema and induration is what you typically see, which is called Mantoux positive. So how will you interpret what is ultimately Mantoux test is telling? Mantoux test is not telling whether you have an active TB or not. It is only telling one thing. Are you sensitized? That means, do you have exposure? Exposure. Does your body has exposure to the mycobacterium? It is only telling that. It is not telling anything that you have disease. Please remember, it is only an indicator. It is not a diagnostic. If Mantoux is positive, ka matlab you have TB ka matlab nahi hai. That is a point you need to remember. Then another thing, how strong is this Mantoux? That is another thing you should be very sure about before you call the person Mantoux positive, right? So suppose if he is HIV positive, then typically when IL-2, IFN, gamma, interferon gamma, they are all produced by whom? The CD4 T cells. But a HIV positive person, his CD4 count is low. So even if you expose him to this soluble tuberculin molecule, there is no T cell available to produce all these mediators. So the Mantoux can still remain negative, or there may be a small reaction in case of HIV positive individual. So that is the reason you should remember, even more than 5 mm of Mantoux is enough in HIV positive person. Or suppose if you contacted, if somebody in the family already has an active TB and you got exposed, even more than 5 mm is enough. Or suppose on the chest X-ray already nodular fibrotic changes like TB is looking, and even if Mantoux is more than 5 mm is called positive. Then similarly, organ transplant patients, we give immunosuppressive drugs. Their immune system is all suppressed. Even in them, more than 5 mm is considered to be positive. Then when you consider more than 10 mm of the diameter of the Mantoux reaction as a positive reaction, if any recent antiviral therapy if he has taken, IV drug abusers, then if there are some comorbid means when you get a disease you get a suffering, that's called morbidity. Mortality means death, right? So comorbid conditions, diabetes, etc. Children less than 4 years of age, infants who are exposed to high risk categories. So they are all the people, more than 10 mm is enough to call. Suppose if there are no risk factors for TB at all, healthy, hailing individual, unless the size of the reaction is more than 15 mm, you don't call it as a positive Mantoux. So that is the reason. Agar a nurse who is working in TB clinic, every day she is exposed. So if you do Mantoux, obviously she will have a positive skin test. But that does not mean she has an active TB. Then another important point you should know about Mantoux. Mantoux is not a diagnostic test. Is not a diagnostic test. But Mantoux is a prognostic test. मतलब क्या है? If somebody has shown a strong 15 mm induration means his cell-mediated immunity is there or not? Does he have that cell-mediated immunity or not? Very good question by Roja. Sir, how do we diagnose multi-drug resistant TB? Super. I'll tell. But before that, so now you tell me, if somebody mounted more than 15 mm, what does it say? If he has a good cell-mediated immunity, can he produce a strong Mantoux, or if his cell-mediated immunity, that is his T cells are low, he will do that? Right? Give me an answer. Roja, Nagappa, Ranjit, what is your answer? If somebody mounted a positive, strongly positive Mantoux ka matlab, how is his cell-mediated immunity? That means how is his T cells and everything? They are good or bad is my question to all of you. Quick answer. We'll make it interactive. So, if induration is strongly there, Nagappa thinks bad. Roja says that means T lymphocytes are high, sir. Ranjit Shah says good immunity. Absolutely. If you have HIV, if the patient is having HIV, if his immunity T cells are low, then if you do Mantoux, even if he has got TB, he can't show induration, significant induration. But if somebody has shown a significant induration means, how is that induration caused? Induration is caused, that erythema induration Mantoux reaction is caused only if macrophages are there, only if the T cells are adequate. That means it is a sign of good T cells. That is a good prognosis. Good prognosis. So, a strongly positive Mantoux means good cell-mediated immunity, 100 out of 100 marks, and a good prognosis. A negative Mantoux means two possibilities. Either he doesn't have TB or exposure to TB, or second possibility, he may be having TB, but his cell-mediated immunity is weak. That is the meaning of it. So that is the reason. What is the very important statement you have learned today evening, sister? You have learned that Mantoux is not a diagnostic test. It does not diagnose the TB. TB नहीं है, cell-mediated immunity अच्छा है, right? We don't know. So it does not diagnose. But it is a good sign of prognosis. If it is strongly positive, that means at least one thing you know, that his cell-mediated immunity is good, is what you have to basically remember. So how do you do the Mantoux? That's very important. Typically, you have epidermis, below that you have dermis. So, intradermal, it is not subcutaneous. Intradermal injection you will be doing of the PPD. PPD means purified protein derivative. So, Bifidobacterium's protein को purify करके उसको PPD बोलते हैं. You will inject into dermis. Then that lead to a small bleb formation. Bleb will form. And typically 5 to 9 millimeter, if it is of the size, then you call category 1 positive, and 10 to 14 is called category 2 and positive. More than 15 is called strongly positive, is what you have to basically remember. Now, 2 questions from Roja. How do you diagnose multi-drug resistant TB? Very simple. TB treatment you have given, and you will try to do the sputum AFB. Suppose in spite of taking treatment, AFB is still positive. Then you will send the sputum for BACTEC test. So in this test, you will look at the sensitivity to various TB drugs. How is the sensitivity? Especially isoniazid, rifampicin, how is the sensitivity? If multiple drugs, especially INH, rifampicin, if there is a resistance, then you call it as multi-drug resistant TB. So you will send for BACTEC test to diagnose the resistance. Then Roja is asking another question. How will you diagnose TB in children? Anybody, fundamentally, it is a sputum examination, chest radiograph is what you will order in order to make the diagnosis. So let us see a few examples. This is an example of a strongly positive Mantoux, 30 millimeters in induration, 3 centimeters is what you need to remember. So with this, today we call it a day, sister. So Nagappa and Ranjit, Roja, today our first live online class. You are all the participants. We will grow into a very big number. Thousands of students attending every day across the country. But today evening will always be remembered with a great memory. You being the first students who have attended this session. So thank you so much for participating. And tomorrow once more morning 10 a.m. we have a live broadcast. Ask your friends also to join. And don't forget to buy the subscription in the nursenaukri.com where you have the entire video library made available. Thank you so much.